Your elderly mother calls you one morning. Her voice sounds weak and confused on the phone. She mentions she's burning up with fever but feels freezing cold at the same time. You tell her to rest in bed, take some medicine, call you later. She hangs up the phone. 3 hours pass. Now she's lying unconscious in the emergency room. The doctors in white coats tell you she has sepsis. They explain that if you had brought her to the hospital even 2 hours earlier, her chances of surviving would have been dramatically better. This exact scenario happens every single day in hospitals across America. Right now, at this very moment, someone is lying in bed ignoring the warning signs of sepsis developing in their body. Right now, someone's internal organs are beginning to shut down while they convince themselves they just have a bad flu. According to the Centers for Disease Control and Prevention, sepsis kills at least 350,000 Americans every single year. That's more deaths than breast cancer, prostate cancer, and AIDS combined. The number is staggering, yet most people walking down the street can't identify even one symptom of sepsis. Here's what shocked me when I researched this medical topic. If you catch sepsis in the first few hours, when treatment begins immediately in the emergency room, survival rates jump dramatically upward. Medical studies show that each hour of delay in starting antibiotic medications increases mortality risk. The difference between recognizing sepsis at hour 1 versus hour 6 can literally determine whether someone lives or dies in the hospital. But here's the problem that costs thousands of lives. The early symptoms of sepsis look exactly like common illnesses that seniors experience regularly. A fever that seems like seasonal flu, confusion that looks like dementia acting up, rapid breathing that appears to be anxiety or heart problems. Families sitting at bedsides and even some healthcare providers miss sepsis until it progresses to advanced stages where survival becomes much less likely. In this video, I'll reveal 5 warning signs of sepsis that appear early when medical treatment can still save a life. Number 3 is so commonly dismissed as normal aging that families watch it develop for hours without ever suspecting their loved one is dying in front of them. Before we start, I need to be crystal clear about something important. This video is for educational awareness only. Sepsis is a medical emergency requiring immediate hospital treatment. If you or someone you know shows signs of sepsis, call 911 immediately on your phone. Do not wait to see if symptoms improve. Every single minute counts. Now let's dive into what sepsis is, who's at highest risk, and the 5 warning signs that could save your life or the life of someone you love. Understanding what sepsis actually is and why it's so deadly. Most people walking into clinics think sepsis is the same thing as an infection. That's the first critical misunderstanding that costs lives in emergency rooms. Sepsis is not an infection in your body. Sepsis is what happens when your body's immune response to an infection goes catastrophically wrong. Here's how it works inside your body. When bacteria, viruses, or fungi invade your body, your immune system launches a defensive response to fight the infection. This is normal and necessary for survival. Your immune system releases chemical substances into your bloodstream to combat the invaders. These chemicals trigger inflammation at the infection site. They increase blood flow to deliver immune cells. They create fever to make your body inhospitable to pathogens. This coordinated immune response usually works perfectly to eliminate infections from your body. But with sepsis, something goes terribly wrong inside. Your immune system overreacts dangerously. Instead of targeting just the infection site, the inflammatory response spreads throughout your entire body like wildfire. The chemicals meant to fight infections start damaging your own tissues and organs. Think of your immune system like a fire alarm system installed in your house. When a small fire starts in the kitchen, the alarm alerts you and you extinguish it with a fire extinguisher. That's a normal, proportionate response. But with sepsis developing, it's like the alarm system malfunctions, and instead of just alerting you to the kitchen fire, it sets off explosions in every room of your house simultaneously. The alarm system designed to protect you becomes the thing destroying your home. Research from the Journal of the American Medical Association describes sepsis as a dysregulated host response to infection. Your blood vessels begin leaking fluid into surrounding tissues like water seeping through cracks. Blood pressure drops because there's not enough fluid in your vessels to maintain normal pressure. Organs don't receive adequate oxygen and nutrients because blood flow becomes chaotic and insufficient. If not stopped quickly with medical intervention, this cascade progresses to septic shock, where blood pressure drops so dangerously low that organs begin failing. The kidneys stop filtering waste from blood, the liver stops processing toxins circulating, the lungs fill with fluid, making breathing impossible. The heart muscle struggles to pump effectively. Here's how serious this medical situation is. The CDC reports that sepsis affects at least 1.7 million adults in the United States every single year. Of those 1.7 million patients, at least 350,000 die in hospitals. That means sepsis contributes to 1 in every 3 deaths that occur in hospital settings. Let that statistic sink into your mind. 1 in 3 hospital deaths involve sepsis. And here's what makes sepsis uniquely dangerous compared to other medical emergencies. It moves with terrifying speed through your body. You might feel relatively normal in the morning and be fighting for your life by dinner time in intensive care. You don't get weeks or even days to gradually worsen and seek help. With sepsis, you have hours on the clock. The window for effective medical treatment is measured in hours, not days. That's why knowing these symptoms isn't just helpful medical information to file away. This is the kind of knowledge that separates life and death. This is information that could save your mother lying in bed, your father sitting in his chair, your spouse sleeping beside you, or yourself. Sepsis can theoretically happen to anyone who develops an infection, but certain people face dramatically higher risk and need to be especially vigilant about recognizing symptoms. Who faces the highest risk of developing sepsis? If you recognized yourself or someone you care for in this list, memorize every symptom I'm about to teach you. Your life may depend on it. First, and most importantly, if you're over 65 years old, you're in the highest risk category. According to the CDC, adults 65 and older have a sepsis-related death rate of 330.9 deaths per 100,000 people. Why does age increase risk so dramatically? Your immune system naturally weakens as you age, a process called immunosenescence. The white blood cells that fight infection become less effective. They respond more slowly to bacterial threats. They produce fewer antibodies. This means infections that a younger person's immune system would quickly eliminate can spiral out of control in older adults, triggering sepsis before the immune system mounts adequate defense. Additionally, older adults often have multiple chronic health conditions and take numerous medication, which further compromise immune function. The body's reserve capacity to handle stress diminishes with age. What might cause a young person to feel sick for a few days can push an older person's body into organ failure. If you have diabetes, listen closely because this concerns you directly. Diabetes impairs your body's ability to fight infections in multiple ways. High blood sugar creates an environment where bacteria thrive. It impairs white blood cell function, reducing their ability to kill pathogens. Diabetics experience poor circulation, particularly to extremities, meaning immune cells can't reach infection sites quickly. Nerve damage from diabetes means you might not feel pain from an infection developing. A simple urinary tract infection that a non-diabetic would notice and treat early can progress silently in a diabetic until sepsis develops. A small cut on your foot that you don't feel because of neuropathy can become infected, and before you realize how serious it is, bacteria have entered your bloodstream, triggering sepsis. If you've recently had surgery, even something considered minor like a dental procedure, you're at elevated risk for the following weeks. Anytime your skin is cut or your body is invaded medically, bacteria can potentially enter your bloodstream. Surgical incision sites can become infected despite best sterile techniques. Urinary catheters, IV lines, and breathing tubes in hospitals provide pathways for bacteria to enter your body. Post-surgical patients need to monitor incision sites carefully and report any signs of infection immediately. If you have a weakened immune system from chemotherapy, HIV, organ transplant medications, or chronic steroid use, your body cannot defend itself the way it normally would. These medications and conditions suppress your immune system's ability to fight infections. What would be a minor infection in someone with a healthy immune system can rapidly progress to sepsis when your immune defenses are compromised. If you have chronic diseases affecting major organs, particularly kidney disease, liver disease, or chronic lung diseases like COPD, your organs are already under stress. They're not functioning at full capacity. Sepsis pushes these already struggling organs past their breaking point. Kidney disease patients are at particularly high risk because they can't efficiently clear toxins and bacteria from their blood. Liver disease patients can't process the inflammatory chemicals released during sepsis. COPD patients can't oxygenate their blood adequately when sepsis causes fluid to accumulate in lungs. The CDC also reports significant gender differences in sepsis outcomes. Men face higher death rates from sepsis than women do. The rate for men is 371.7 deaths per 100,000 compared to 297.4 per 100,000 for women. Researchers aren't entirely certain why this disparity exists, but theories include hormonal differences affecting immune response, men's tendency to delay seeking medical care, and higher rates of cardiovascular disease in men that compound sepsis complications. If any of these risk factors describe you or someone you care for, what you're about to learn becomes even more critical. You can't change your age or eliminate chronic diseases, but you can recognize warning signs early and act immediately. Now, let me walk you through the 5 symptoms that appear early in sepsis, when medical treatment can still prevent organ failure and death. Warning sign number 5: extreme temperature changes that swing unpredictably. Starting with what many people think is the most obvious sign of infection, temperature changes with sepsis follow patterns that differ from normal illness. Most people with sepsis develop a high fever over 101 degrees Fahrenheit or 38.3 degrees Celsius. This fever often comes on rapidly. You check your temperature with a thermometer and it's normal. 2 hours later, you're burning up at 103. The fever typically doesn't respond well to over-the-counter fever reducers. You take acetaminophen or ibuprofen pills, and your temperature barely drops, or it drops temporarily, then spikes right back up. But here's what catches many people completely off guard and causes them to dismiss sepsis as a possibility. Some people developing sepsis don't get fevers at all. Instead, their body temperature drops dangerously. They develop hypothermia, with core temperature falling below 96.8 degrees Fahrenheit or 36 degrees Celsius. This hypothermic response is particularly common in elderly patients, very young children, and people with weakened immune systems. Their bodies can't generate the fever response that would normally fight infection. Research from the journal Critical Care Medicine found that hypothermia in sepsis actually indicates more severe disease and predicts worse outcomes than fever does. If you or someone you know feels freezing cold, can't warm up no matter how many blankets they pile on, and is shivering uncontrollably in bed, don't dismiss it because there's no fever. Check their actual temperature with a digital thermometer. If it's below 97 degrees and they have other symptoms we'll discuss, this could be sepsis. What makes temperature changes significant is their association with other symptoms. Isolated fever or isolated feeling cold might be many things, but when temperature abnormalities occur alongside rapid heart rate, confusion, or breathing changes, the combination demands immediate medical evaluation. Additionally, pay attention to how the person looks and feels with their temperature changes. Someone with a simple flu typically looks sick but not critically ill. Someone with sepsis often looks profoundly unwell in a way that's hard to describe but frightening to witness. Their skin might look mottled or grayish. They might be drenched in sweat or feel clammy to touch. They often describe feeling the worst they've ever felt in their life. If someone has a fever or hypothermia and says something feels really wrong, this is different from being sick before. Trust that instinct. Don't convince them or yourself that it's probably nothing. Temperature changes alone aren't diagnostic, but they're often the first sign that makes people start paying attention. What matters is recognizing when that fever or chills is part of a larger, more dangerous picture. Warning sign number 4. Racing heart and rapid breathing even at rest. Moving to symptoms that families often attribute to anxiety or panic attacks, cardiovascular and respiratory changes indicate your body is struggling to maintain adequate oxygen delivery to tissues. With sepsis, your heart starts racing, beating faster than 90 beats per minute even when you're sitting completely still or lying down in bed. You can feel your heart pounding in your chest. You might feel it pulsing in your neck or hear it in your ears. This rapid heart rate, called tachycardia in medical terminology, persists. It doesn't slow down when you rest or take deep breaths. Simultaneously, your breathing rate increases dramatically. You're taking more than 20 breaths per minute. Normal breathing at rest is about 12 to 16 breaths per minute. Count your breaths for 60 seconds and you'll be well over 20. You feel like you just climbed a flight of stairs, but you haven't moved from your chair. You can't seem to catch your breath. You feel short of breath even though you're not exerting yourself. Research published in the New England Journal of Medicine explains why these changes occur. Sepsis causes blood vessels throughout your body to dilate and leak fluid. This reduces the volume of fluid actually circulating in your blood vessels, making blood pressure drop. Your heart responds by beating faster, trying to circulate the reduced blood volume more quickly to maintain adequate pressure and oxygen delivery. Simultaneously, sepsis causes inflammation in your lungs. Tiny air sacs called alveoli fill with fluid, making oxygen exchange less efficient. Your lungs aren't transferring oxygen into your blood as effectively as normal. Your body detects this reduced oxygen level and increases breathing rate, trying to pull in more oxygen to compensate. Your heart and lungs are working overtime, desperately trying to keep your organs supplied with oxygen. What makes these symptoms particularly easy to dismiss is that rapid heart rate and breathing can result from numerous causes, including anxiety, panic attacks, heart problems, or lung conditions that have nothing to do with sepsis. Many people, particularly elderly individuals, have chronic conditions causing baseline increased heart rate or shortness of breath. But here's the key distinction. With sepsis, these symptoms come on relatively suddenly and are more severe than the person's baseline. Someone who normally has a heart rate of 75 beats per minute suddenly has a rate of 110. Someone who normally breathes comfortably suddenly can't catch their breath. And critically, these changes don't improve with rest, relaxation, or treatments that normally help the person's chronic conditions. Additionally, when rapid heart rate and breathing occur together with fever or temperature changes and confusion, the combination strongly suggests sepsis rather than isolated heart or lung problems. If you notice someone breathing rapidly, you can assess severity by counting their breaths per minute. Watch their chest rise and fall, counting each complete breath cycle. Do this for a full 60 seconds. If they're taking more than 22 breaths per minute at rest, and this is unusual for them, this warrants medical evaluation. Check their pulse by placing 2 fingers on the inside of their wrist below the thumb. Count heartbeats for 60 seconds. If pulse is above 90 and they're not exerting themselves, combined with rapid breathing, don't dismiss this as anxiety. Consider sepsis as a possibility. Warning sign number 3. Sudden confusion that looks exactly like dementia. This is the warning sign that families miss most often, and it's particularly dangerous in elderly patients. Sudden confusion, Altered mental status or delirium represents one of the most common presenting symptoms of sepsis in older adults. Yet families and even some healthcare providers attribute it to age-related dementia rather than recognizing it as a medical emergency. Here's what this looks like. Someone who was mentally clear, oriented, and conversing normally just hours ago suddenly can't tell you what day it is. They don't know where they are. They might not recognize family members they see every day. They say things that don't make sense. They might see things that aren't there, hallucinating people or objects in the room. They might become agitated, trying to get out of bed or leave the house for no clear reason. Or they might become abnormally sleepy, barely responding when you talk to them. Research from the Journal of the American Geriatric Society found that altered mental status is present in up to 60% of elderly patients with sepsis at the time they seek medical care. In many cases, confusion is the predominant symptom that brought them to medical attention, while other classic sepsis symptoms like fever are absent. Why does sepsis cause confusion? Multiple mechanisms contribute. Sepsis reduces blood flow to the brain. When blood pressure drops and blood vessels dilate, less blood reaches brain tissue. Brain cells require constant oxygen and glucose delivery. When blood flow decreases, brain cells can't function properly, causing altered consciousness. Additionally, the inflammatory chemicals released during sepsis can cross the blood-brain barrier and directly affect brain function. Cytokines and other inflammatory mediators that flood your bloodstream during sepsis enter brain tissue and disrupt normal neuronal communication. Sepsis also commonly causes metabolic derangements, including low blood sugar, abnormal sodium levels, or kidney failure causing waste product accumulation. All these metabolic abnormalities affect brain function, causing confusion. What makes confusion so dangerous as a sepsis symptom is how easily it gets misattributed, particularly in elderly patients. Family members think, "Dad has dementia and it's just getting worse." They don't realize that true dementia progresses gradually over months and years, not over hours and days. Healthcare providers in emergency rooms sometimes see an elderly, confused patient and assume it's baseline dementia without investigating acute medical causes. This delay in recognizing sepsis costs lives. Here's the critical distinction that could save someone you love. Dementia develops slowly over time. If someone was functioning normally last week, last month, or even yesterday, and suddenly today they're profoundly confused, that's not dementia progressing. That's an acute medical problem, possibly sepsis. Think about the timeline. Did this confusion develop over hours to days, or has it been progressing gradually over months? Acute onset confusion demands immediate medical evaluation. Don't let anyone tell you it's just dementia if the confusion came on suddenly. Additionally, even in people who do have existing dementia, acute worsening of confusion beyond their baseline represents a medical emergency. Someone with mild dementia who normally functions pretty well suddenly becomes severely confused and agitated. This acute change on top of chronic dementia often indicates sepsis or another serious medical problem requiring urgent treatment. If you're caring for someone with dementia, you know their baseline. You know how they normally function, what they can and cannot do, whether they usually recognize people and know where they are. When you see significant acute worsening beyond their normal baseline, don't dismiss it as dementia getting worse. Consider sepsis and other acute medical problems. The message here is simple but critical. Sudden confusion is never normal. Sudden confusion is never just dementia. Sudden confusion demands immediate medical evaluation, and sepsis must be considered and ruled out. Warning sign number 2. Severe pain or overwhelming feeling that something is terribly wrong. Pain and discomfort with sepsis differs fundamentally from ordinary illness in its severity and character. People developing sepsis consistently describe feeling worse than they've ever felt in their entire lives. This isn't, "I feel sick" or "I have a bad flu." This is, "Something is profoundly wrong with my body and I feel like I'm dying." The pain might be localized to a specific area. If the sepsis originated from a urinary tract infection, you might have severe abdominal or back pain. If it started from pneumonia, you might have intense chest pain. If it began from an infected surgical wound, that area might be excruciatingly painful, but often the pain is more diffuse and difficult to pinpoint. You might feel overwhelming discomfort throughout your entire body. Every muscle aches intensely, your joints hurt. You feel a deep bone-level pain that isn't relieved by position changes or pain medications you normally take. Research from the journal Pain Medicine found that sepsis causes widespread pain through multiple mechanisms. The inflammatory chemicals released during sepsis sensitize pain nerves throughout your body, making you hypersensitive to painful stimuli. Sepsis causes your organs to swell and become inflamed. When your liver, kidneys, or spleen swell, they press against the capsule surrounding them, triggering severe pain. Your tissues break down as sepsis progresses. Muscle tissue breaks down in a process called rhabdomyolysis. This releases proteins into your bloodstream that damage kidneys while causing severe muscle pain. What makes pain particularly significant as a warning sign is its association with other symptoms and its severity. Someone with regular flu feels lousy but usually can be distracted, can watch television or talk. Someone with sepsis often can't focus on anything except how terrible they feel. They might curl up in bed moaning. They might pace because they can't get comfortable. They look visibly distressed in a way that's frightening to witness. Additionally, people with sepsis often describe a feeling of impending doom. This is an actual medical term used to describe the sensation that something catastrophic is happening to your body. You can't explain exactly what's wrong, but every instinct tells you that you're in serious danger. This feeling of impending doom appears to result from your body detecting that major systems are failing. Your brain receives distress signals from throughout your body, indicating that something is going catastrophically wrong, even before you can consciously identify what's happening. This instinct should never be dismissed. If someone says, "I feel like I'm dying, something is really wrong, or I've never felt this bad before," believe them. Don't convince them or yourself that it's probably nothing. Trust that instinct because it often reflects your body's accurate assessment that you're in serious danger. Healthcare providers are trained to take seriously when patients describe feeling like something is terribly wrong. In emergency medicine, when a patient says, "I feel like I'm dying," doctors immediately increase their level of concern and investigate more thoroughly because that statement so often indicates serious pathology. If someone makes statements like this, particularly if accompanied by other symptoms we've discussed, get them to an emergency room immediately. This isn't overreacting. This is appropriate recognition of danger signals. Warning sign number 1. Skin changes that indicate blood flow is failing. Taking the top position, skin changes with sepsis provide visible evidence that your cardiovascular system is failing and tissues aren't receiving adequate oxygen. These changes can appear anywhere on your body, but are often most noticeable on your arms, legs, and torso. You might see red or purple spots appearing on your skin. These spots, called petechiae when small or purpura when larger, don't fade or blanch when you press on them. Press your finger firmly against the spot for a few seconds, then release. If the spot remains the same dark red or purple color without lightening, this indicates bleeding under the skin. These spots appear because sepsis damages blood vessel walls, causing them to leak blood into surrounding tissue. Your skin might feel cold and clammy despite fever. You're sweating profusely, drenching your clothes and sheets, but your skin feels cold to touch rather than hot. This happens because blood vessels in your skin constrict, reducing blood flow to your skin to preserve blood flow to vital organs. Your body sacrifices your skin to try to save your heart, lungs, brain, and kidneys. Your skin might look mottled with blotchy patches alternating between pale and dark areas. This mottling, particularly noticeable on arms and legs, indicates severely impaired blood flow. Some areas receive adequate blood and look relatively normal. Other areas receive inadequate blood and look pale or dusky. Research from the Mayo Clinic explains that these skin changes happen because sepsis disrupts normal blood vessel function throughout your body. Blood vessels that normally dilate and constrict smoothly to regulate blood flow become dysfunctional. Some areas experience excessive constriction, cutting off blood flow. Other areas experience excessive dilation, causing blood to pool. In severe cases, fingers and toes might turn blue, purple, or even black. This represents tissue death from complete lack of oxygen, a condition called gangrene. When tissue dies, it cannot be revived. Patients with severe sepsis sometimes require amputation of fingers or toes that died from inadequate blood flow. What makes skin changes particularly valuable as warning signs is their visibility. You can see them with your eyes. You don't need medical equipment or special training. Just look at the person's skin. If you see red or purple spots that don't blanch, if you see mottling, if you see blue or black discoloration of fingers or toes, combined with any other symptoms we've discussed, this is a medical emergency. Additionally, skin temperature and moisture provide useful information. Touch the person's forehead, arms, and legs. Does their skin feel cold and clammy? Are they sweating profusely? These physical findings, combined with fever or confusion, should trigger immediate concern about sepsis. The critical message about all 5 warning signs is this: isolated symptoms might represent many things. A fever alone might be flu. Confusion alone might be a medication side effect. But when you see combinations of these symptoms appearing together, particularly with acute onset over hours rather than gradual development over days, sepsis must be considered. Don't talk yourself out of seeking medical care. Don't convince yourself you're probably overreacting. With sepsis, overreacting means getting evaluated and potentially treated early, which saves lives. Underreacting means delaying care, which increases mortality dramatically. The most dangerous symptom that means you're running out of time. Now let me tell you about the symptom that indicates sepsis has progressed to its most dangerous stage: septic shock. This is the point where mortality rates skyrocket and survival becomes uncertain. The symptom is sudden, severe drop in blood pressure. Normal blood pressure for most adults is around 120/80. With septic shock, systolic blood pressure, the top number, drops below 90 despite fluid resuscitation. When blood pressure falls this low, your organs aren't receiving adequate blood flow. Your kidneys, which filter waste from blood, start shutting down. Urine output drops dramatically. Toxins accumulate in your blood. Your liver, which processes medications and removes toxins, stops functioning properly. Your brain, which requires constant oxygen delivery, doesn't get adequate blood flow. You become increasingly confused, then stuporous, then unconscious. You might feel extremely dizzy or lightheaded. You feel like you're going to faint. You might experience a sensation of the room spinning. You try to stand and immediately feel like you're going to pass out. You might actually lose consciousness, collapsing without warning onto the floor. Research from the journal Intensive Care Medicine found that once sepsis progresses to septic shock, mortality rates jump to 30 to 40%, even with optimal treatment. Compare this to early sepsis, where mortality rates are closer to 10 to 15% with prompt treatment. The difference is staggering and demonstrates why early recognition matters so profoundly. What makes septic shock particularly deadly is that it represents multiple organ systems failing simultaneously. It's not just low blood pressure, it's kidney failure, liver failure, respiratory failure, and cardiovascular collapse happening together. At this stage, patients require intensive care unit admission, mechanical ventilation to breathe, powerful medications called vasopressors to support blood pressure, and sometimes dialysis if kidneys have failed completely. Let me be absolutely crystal clear about this. If you or someone near you shows signs of possible sepsis and suddenly becomes extremely dizzy, weak, or loses consciousness, this is a medical emergency of the highest priority. Call 911 immediately on your phone. Do not attempt to drive yourself or the person to the hospital. Driving wastes precious time and is dangerous if the person loses consciousness while driving. Do not wait to see if symptoms improve. They won't improve without treatment. They will only worsen. Do not try to sleep it off or wait until morning. Studies show that in septic shock, each hour of delay before starting antibiotic treatment increases mortality risk. The difference between getting help now versus waiting another hour could literally be the difference between life and death. This isn't exaggeration or trying to frighten you unnecessarily. This is medical reality based on extensive research and clinical experience. When someone is in septic shock, minutes count. Their organs are failing. Without immediate intervention, they will die. I'm not trying to scare you for no reason. I'm trying to prepare you so that if this situation ever occurs, you'll recognize it immediately and act without hesitation. Because when sepsis progresses to shock, you don't get time to research symptoms or think it over. You must act decisively and immediately. Exactly what to do if you think someone has sepsis. Now that you know the warning signs, let me give you a specific action plan for what to do if you suspect sepsis. First and most importantly, do not wait it out. Sepsis does not improve on its own. It only progresses and worsens. Don't tell yourself it's probably just the flu. Don't convince yourself you're overreacting. Don't wait until morning to call the doctor. If you have signs of infection like fever, chills, or a known infection site, plus any combination of the warning signs I've described, particularly confusion, rapid breathing, or skin changes, take action immediately. If symptoms are concerning but not immediately life-threatening, call your doctor right away on the phone. Explain the symptoms clearly and use the specific word sepsis. Say, "I'm worried this might be sepsis." Doctors are trained to respond urgently when they hear that word because they understand its implications. Your doctor will likely tell you to go directly to the emergency room for evaluation. If symptoms are severe, particularly confusion, severe difficulty breathing, chest pain, inability to stand without feeling faint, or loss of consciousness, do not call your doctor first. Go straight to the emergency room or call 911. Time is critical, and you can't afford delays. When you arrive at the hospital entrance, tell the triage nurse immediately, "I'm concerned about sepsis." Hospitals have specific protocols called sepsis bundles that activate immediately when sepsis is suspected. These protocols ensure a rapid evaluation and treatment. The emergency room team will perform rapid assessment, including checking vital signs, blood pressure measured with a cuff, heart rate counted, breathing rate observed, temperature taken with a thermometer, oxygen levels checked with a pulse oximeter. They'll draw blood for laboratory tests, checking for signs of infection, organ function, and inflammatory markers. They'll check lactate levels in your blood. Elevated lactate indicates your tissues aren't receiving adequate oxygen. They may perform imaging studies like chest x-rays to look for pneumonia or CT scans to identify infection sources. If sepsis is confirmed or even strongly suspected, treatment begins immediately without waiting for all test results. Early treatment is that critical. Treatment includes several components that start simultaneously. First, broad-spectrum antibiotics given intravenously through an IV line. These powerful antibiotics are chosen to cover the most likely bacterial causes before specific infection identification. Studies show that early antibiotic administration, ideally within an hour of sepsis recognition, significantly improves survival rates. Second, intravenous fluids given rapidly through IV tubes. Sepsis causes blood vessels to leak fluid and blood pressure to drop. Large volumes of IV fluid help restore blood pressure and improve organ perfusion. Third, oxygen supplementation through tubes in the nose. Many sepsis patients can't oxygenate their blood adequately. Supplemental oxygen through nasal cannula or mask helps maintain adequate oxygen levels. In severe cases, mechanical ventilation with a breathing tube inserted down the throat may be necessary. Fourth, medications to support blood pressure if fluids alone are inadequate. These vasopressor medications constrict blood vessels and support heart function, maintaining adequate blood pressure to perfuse organs. Fifth, treatment of the underlying infection source. If sepsis originated from an infected surgical wound, that wound requires drainage and debridement. If from an infected gallbladder, surgery to remove it may be necessary. The key to survival is speed. The faster treatment starts in the emergency room, the better outcomes become. That's why you cannot afford to ignore warning signs or delay seeking care. How to protect yourself before sepsis ever becomes a threat. While recognizing sepsis symptoms is critical, prevention is even better. Let me walk you through strategies to reduce your risk of ever developing sepsis. Step 1. Prevent infections aggressively. Sepsis cannot occur without an underlying infection. Reducing infection risk eliminates most sepsis risk. Wash your hands thoroughly and frequently with soap, particularly before eating, after using the bathroom, after being in public places, and after contact with anyone who's sick. Use soap and water, scrubbing for at least 20 seconds. Hand sanitizer works when soap isn't available, but hand washing is more effective. Get recommended vaccinations at the clinic. Flu shots reduce risk of influenza, which can progress to pneumonia and sepsis. Pneumonia vaccines protect against bacterial pneumonia. COVID-19 vaccines reduce severe infection risk. Shingles vaccines prevent this painful infection that can become complicated. Keep cuts, scrapes, and wounds clean and properly covered with bandages. Even small cuts can become infected if not cared for properly. Wash wounds with soap and water, apply antibiotic ointment, cover with clean bandages. Watch for signs of infection, including increasing redness, swelling, warmth, or pus. If you have diabetes, maintaining good blood sugar control is essential. High blood sugar impairs immune function and promotes infection. Check blood sugar regularly with a glucose meter. Take diabetes medications as prescribed. Follow dietary recommendations. Attend regular doctor appointments for monitoring. Step 2. Treat infections promptly and completely. Don't let infections linger untreated. A urinary tract infection ignored can progress to kidney infection and sepsis. Pneumonia left untreated can become severe. Skin infections that seem minor can spread into bloodstream. If you develop fever, chills, pain, unusual redness or swelling, drainage from wounds, or other signs of possible infection, see your doctor promptly. Don't wait days hoping it improves on its own. If antibiotics are prescribed, take them exactly as directed. Take the full course even if you feel better halfway through. Stopping antibiotics early allows bacteria to survive and potentially develop resistance. Step 3. Know your body and trust your instincts. You know what normal feels like for you. If something feels different or wrong, pay attention. If you normally have a body temperature of 98.6 degrees and suddenly it's 100 degrees with chills, your body is telling you something is wrong. Don't dismiss symptoms as just getting older. Age-related changes develop gradually, not suddenly. Acute changes in how you feel warrant investigation. Trust your instincts when you feel something is seriously wrong. Step 4. Be an active participant in your healthcare, especially in hospitals. If you're hospitalized for any reason, stay alert to infection risks and speak up about concerns. Ensure healthcare workers wash their hands before touching you. Don't be afraid to ask, "Did you wash your hands?" Healthcare-acquired infections are a major source of sepsis. Ask about your IV sites. Are they changed regularly? Is the insertion site red or painful? Inquire about surgical wounds. How should they look? What signs would indicate infection? Ask about urinary catheters. Do you really need it? Catheters increase infection risk and should be removed as soon as medically appropriate. Speak up if something doesn't feel right. If you develop fever, confusion, or other concerning symptoms while hospitalized, inform your nurse immediately. Don't assume hospital staff will notice everything. You are your own best advocate. Research consistently shows that patients who actively participate in their care, ask questions, and speak up about concerns have better outcomes and lower complication rates. What you must do right now. If this information helped you understand sepsis and gave you tools to recognize it early, I need you to do something immediately. First, like this video right now by clicking the thumbs up button. The algorithm will show it to more people, and somewhere out there, someone is developing sepsis symptoms right now without understanding what they mean. You could save their life by helping this video reach them. Second, subscribe to this channel by clicking the subscribe button and turn on notifications by clicking the bell icon. I create evidence-based health content specifically for people over 60 and their families, content that could literally save your life. Third, share this video. Send it to your parents, your spouse, your siblings, your adult children. Post it on your social media accounts. You never know who needs this information right now. Fourth, drop a comment below. Type learned if you're going to remember these warning signs. Type shared if you're sending this to someone who needs to see it. I read every comment, and your engagement helps more people see this life-saving information. Fifth, watch the next videos we've selected for you on the screen. We have more content on recognizing medical emergencies, managing chronic conditions, and protecting your health as you age. Thank you for being here. Thank you for caring enough about your health and your family's safety to watch this entire video. Take care of yourself. Pay attention to your body's warning signs. Trust your instincts when something feels wrong. And remember, when it comes to sepsis, every hour matters. Don't wait. Act immediately. Your life or the life of someone you love may depend on it.